I'm Kerry Fink with Helping Seniors of Brevard. It is a pleasure to be with you today. Today is Friday, May the 8th, and we hope that you've enjoyed a good, safe week. And here we are with Helping Seniors Update. On behalf of Joe Steckler and the entire crew from Helping Seniors, we're here to support you through these entire COVID-19 times. And Kim Bernard, our education specialist, is available at our Senior Information Helpline, which, by the way, has helped more than 3,000 families free of charge throughout Brevard County over the past years since it was first established by Joe Steckler a number of years ago. So you can always reach her at 321-473-7770. That's 321-473-7770. And today on Friday, this is the first week that we've actually been in phase one reopening of Florida. And what that basically means is that public beaches are reopened, Florida state parks are reopened, elective surgeries can resume, restaurants can offer outdoor seating with 6-foot space between tables and indoor seating at 25% capacity. Retail can operate at 25% indoor capacity. There are some things that are not yet open. That includes schools remaining distance learning. They're not ready to reopen bars, gyms, personal services such as hairdressers and things like that. Also, visits to senior living facilities, of course, are still prohibited. And so that was one of the reasons why I asked Dr. Kevin Kilday, who is my guest today for Helping Seniors Updates, to join us. Dr. Kevin Kilday is the owner, operator, and expert for Holistic Health Centers US, and we've done a number of television shows, radio shows, and things like that. You have a tremendous background of helping people through addictions, through counseling, but also specifically, you have some cancer therapies and things that you work on a holistic and natural way of getting through. And I thought it would be interesting to ask you if you would come back today and talk a little bit about, as things are opening for seniors especially, because we know that's the population we're working hardest to protect from this COVID-19. If you're a senior, I wanted to ask you what advice you have for people as they're getting back and starting to figure out, is it safe to go back outside? What should I do? How should I approach this? So welcome, Dr. Kevin.
Well, thank you for having me, Kerry. Yes, as a senior, I experience some of the same issues that the seniors might be experiencing. After being in lockdown for the past 4-5 weeks, and one of them is I would think would be the fear of the unknown and fear of going outside. Especially if their health immune system is compromised by some health conditions. As per the CDC, it was anyone with high blood pressure or obesity, or anybody with a compromised immune system, really ought to be very careful and practice strict safety measures when going outside. And that's one thing I do. I mean, I don't walk into anywhere. I don't care if there's one person going to be in there. I wear a mask, because I don't know that person, and or multiple people. So I protect myself by by wearing a mask, as they instruct us to do, and try to maintain that 6-foot distance, which is also highly recommended. But I really think most of all is it's really getting rid of the fear, the fear of going back outside, especially if you've been watching the news quite a bit. And I mean, the news these days can really put some fear in you.
Sure.
I'm a news watcher. I like to stay on top of things, but it's tough when people are are speaking the truth about, that it's something that can really hurt you or be fatal to you. And so it's good to, you just try to get rid of that fear, because you know that you have a mask on, which kind of works two ways. You're protecting, yourself from breathing in any of the coronavirus particles. And it also, they say it stops you from touching your face, because that's one of the things that they tell you, not to do, is when you're out and about and touching things and everything, do not touch your face. So they say wearing a mask kind of like helps you also, to stop doing that. So so those are some of the the things to do, and just to just venture out. I mean, if like, even if you're if you have somebody that may come and visit you, that would have normally taken you out for walks, like a CNA or a nurse or whatever person that you had helping you, or if you're in a wheelchair, just venture outside, just go for a walk, because I had mentioned this on the last show, that being out in Florida, and most of our days are sunny, you can get a lot of vitamin D from the sun. And so it's just good to go outside and just get some sun rays. May it be for 5 minutes, 10 minutes, 15 minutes. After that, if you're fair skinned, maybe you shouldn't go beyond that. But that gives you an elevated level of vitamin D, which improves your immune system and fights off any viruses, including the coronavirus, that may be attacking you.
That sounds like really good advice. Plus, this is a pleasant time. I was actually speaking with somebody up north, and I said, this is really a great time because it's nice and sunny, but we haven't hit the hot part of summer. So it is a nice time to be out a little bit, I think.
Right. So, and also what they said recently is actually the really hot weather actually kills the coronavirus on surfaces. So if something is out in the sun, there's something like a bench or something that someone's getting ready to sit on. If the sun has been blaring on that bench for a while, the chances are there's no coronavirus on the bench.
Oh, that's also good to know. So, Dr. Kevin, let me ask you about this as we keep moving on the Helping Seniors updates, because we are asking businesses in the area saying, are you open, and how do people get in touch with you? So tell us a little bit about, are you open, and just that question, how do people get in touch with you?
Yes, I am open. I must say, I'm trying to get back to business as usual.
Sure.
I do see, clients on a one-to-one basis at 4 different locations. But the main one I use is in the 1900 building in Melbourne,
right?
On US 1, and but what I do ask people, if they come and see me, just to follow the safety procedures, and to wear a mask, because I'll be wearing one also as I'm talking to you.
That seems like good advice.
Also, these rooms are, that are available to me. I'm using a bigger room now, and there's no offense to the client or anything, but I just ask them, if they can sit maybe 6 feet away.
Social distancing.
We're going to be alone in the room, so they'll be able to hear me with no problem. So it's just continuing those safety measures until, hopefully someday in the near future, this coronavirus is dead and gone.
There you go.
But you just have to follow these things until that time.
So how do people get in touch with you? What's the best number to reach
Yes.
Holistic Health Center?
Yes, my phone number is 321 549-0711.
Okay, one more
And,
time.
I'm the one that answers the phone.
Mhm.
So you would get, a majority of the time you would get me unless I'm busy. I try to call you back as soon as I possibly can. Sometimes it's 24 hours, but in most cases, I get back to you the same day.
And again, that number?
Yeah, 321
Yeah.
549 0711.
And you
And
also,
our website
Mhm.
is holistichealthcenter.us. And we have some exciting new services that I just worked out with another practitioner. And it's not even up on my website yet, but feel free to call me. But we are offering infrared saunas for sale and also for use.
Mhm.
And they have found that heat combined with infrared kills kills viruses, including the coronavirus.
Good
You
to know. So
know,
I wanted to thank you, Dr. Kevin Kilday, for joining us today on the Helping Seniors Update. And viewer, I just wanted to remind you two things real quickly. You can get really good information at helpingseniorsupdates.com, because what we do is we archive these and you can go back through and check any of these. And there's also a list of resources. There's food banks, there's tips from State Attorney Phil Archer. There's some financial tips there as well if you're not sure how to approach your bank about needing to defer a payment or something like that. There's good information on the Helping Seniors Updates page, helpingseniorsupdates.com. And of course, we're still pushing full speed ahead on the Helping Seniors Car Raffle. That's our fundraiser, helpingseniorscarraffle.com. Encourage you to get involved in that one. And we encourage you to hopefully have a wonderful, safe, and enjoyable weekend. And we will see you again on Monday for Helping Seniors Updates. Thanks, Dr. Kevin Kilday. Hope you have a good weekend too.
thank you for having me, Kerry.